So I thought I would give you guys a lecture on the coronavirus because there's a lot of information out there. It's super hard to sort through. Some of it's true, some of it's not. And I have a lot of time, so I thought it would be a nice thing for everybody. So in the lecture, we'll cover what coronavirus is, how we make predictions about how it's going to act, like how it's going to spread, where it's going to spread, how it causes the disease, the transmission, symptoms, testing, treatments. I'll let you guys read through those so you know what I'm going to be covering when you ask questions. The Navel Coronavirus. It's actually novel, new, but I liked it. So it originated in Wuhan, China. We've all heard this. The disease is actually called coronavirus disease, COVID-19, which was named by the World Health Organization. Most of my information comes from the World Health Organization website. I find it accurate. It's definitely accurate, and it's the most reliable and gives the most in-depth information. So the disease is called coronavirus disease or COVID-19, and the virus that causes the disease is called severe acute respiratory syndrome, coronavirus 2. Severe acute respiratory syndrome, because in patients later on in the progression of the disease, the virus has the ability to cause breathing issues that they can't breathe on their own. This is a very small percentage, but it's significant. So as of this morning, this is the number of confirmed cases, deaths, and countries involved. And I got this information from the World Health Organization website, which I give you guys a whole list of places that you can go and get great information. So the experts are saying that as dangerous as this disease is, information, the infodemic going around on false information is just as dangerous. So what is a pandemic? There's no definitive cutoffs for what a pandemic is. It really just describes a disease that is new and crossing borders. The World Health Organization really decided to call it a pandemic so that the seriousness of the disease can be impressed upon countries and people so that they act and they adhere to social distancing and hand washing and stuff like that. A lot of the information that you guys will read or get is accurate but skewed. So on one day in Italy, 44% of tested cases didn't have any symptoms, and in Japan it was 0.06%. But that could just mean that Japan only tested people who were known to be sick. You know, you have to see where these numbers are coming from to be able to trust them. And based on data of China, WHO mission report indicates that 75% of people who are asymptomatic at time of testing will progress to clinical disease. So the true asymptomatic infection is probably more than between 1 and 3%, but that's not people who have been tested. You know, there's people who haven't been tested. So that number is also skewed. It's probably a lot smaller. And 70%, okay, that's not really important. Here's another one. This is important to know. Mild cases, so no pneumonia or mild pneumonia. You can have pneumonia and just kind of be in bed like the flu. You don't have to be hospitalized. You just get antibiotics for pneumonia, but not viral pneumonia, like normal pneumonia that you would think of. Usually you get antibiotics. Moderate would be that you actually have trouble breathing. You're having trouble exchanging oxygen in your lungs, so your blood oxygen levels are too low. And then if we scan you in CAT scan or X-ray, the majority of your lungs show changes. I'll show you guys that later too. It's only 14%, and severe would be like ICU admission, and that's only 5%. But again, these numbers are only in people who've been tested. So the numbers are also probably much lower in terms of moderate and severe, because so many people have it that don't know that they have it. So what the people are saying, these are some important pieces that might be good to trust these people when you hear information from them. A lot of the face of news reports, what's it called, like press conferences, Dr. Anthony Fauci, so he's the director of the National Allergy and Infectious Disease Institute. He's a must be a genius to have gotten that title. He's like a big face. Alex Azar was in charge, like a really big bug. And then Mike Pence pushed him aside because obviously Alex Azar probably didn't want to agree with President Trump. Dr. Tedros Adhanom Ghebreyesus, I have to apologize to him, but he's really at the forefront of what's being done and said. He's the Director General of the World Health Organization, and he's doing a great job. And then there's Israeli Health Minister Yaakov Litzman, you can see on the right. So the top priorities right now of the World Health Organization are to protect healthcare workers, because they're the ones really doing the work here on the front lines, to engage communities to protect those at higher risk of severe disease, like older adults and comorbidities, people with comorbidities. Comorbidities are they're medical conditions that people had before being introduced to COVID-19, like high blood pressure and heart disease and diabetes, and then also to support vulnerable countries in containing the infection. We see how it's spreading in countries like America and Israel, and it's spreading like wildfire. But can you imagine in countries who don't have developed healthcare systems, where there's a significant amount of people living in slums? These are places that you really can't enforce social distancing, and people may not have the education to understand it. I feel like even educated people kind of don't understand it, but hopefully I can explain it to everybody in a way that's meaningful. So there's some good that's coming out of what's going on. I want to start it a little lighthearted. I put some humor in this. I know this is nothing to laugh about and it's not funny, but I think it's better to laugh than cry, you know? So try to make it as light and enjoyable as possible for you guys. So it's been really good for the planet. You can see the dolphins are returning to the canals in Venice, and the air pollution has decreased significantly. We're learning that a lot of those meetings really could have been an email. Everyone's working from home, which is pretty nice. It's a good time for self-development. I really recommend journaling or meditation or exercise, taking up a hobby, painting. Great. And getting that revenge bod. I don't know, all of us can do that, right? I also want to stress to you guys that it's really okay to not be okay. This is an unprecedented time in our lives, something that our children hopefully will never have to do. And it's okay to feel lonely. It's okay to be scared. It's okay to not be okay. It's okay. So I want to show you guys a little video to kind of lighten your mood before I scare you guys a little bit.
We live in a time of great technological advances. We live in a time where we believe almost blindly, almost religiously, in the powers of science, scientists, experts, doctors, and yet we are suddenly finding ourselves without a solution, without a clue. We don't know what we're dealing with. We don't know how to respond. We don't know how to control it. We don't even know what it is. It's very good for the soul to be reminded that we have not mastered the universe. We have not conquered nature. We still have a long way to go for that. Now, there are people who actually they say, why would God allow such a virus? Why would God allow such a pandemic? Why would he allow it? What is that suggesting? It's as if some things happen and God intervenes, but then there are other things that happen and God doesn't intervene. Nothing happens unless God makes it. Everything that happens for a divine purpose and a divine reason. Otherwise, it cannot happen. Everything we're going to experience is going to be divinely orchestrated for our benefit. The world is shutting down all its practices. What is our schedule made of? We go here, we go there, we do a little of this and we do a little of that, and then we come home and we've had it. All of a sudden, without anyone saying a word, no theater, no partying, no traveling, no going anywhere. All our habits have now been canceled. We have been freed and liberated from our Mitzrayim. We are so caught up in these things that we actually started to believe that that's what life is about. Life is about going to school, going to work, going to parties, going to a theater, going for some entertainment, going for some shopping. That's life. Now we're seeing this is a very good thing. The break of habit that this virus is bringing is such a fantastic opportunity to change the habits we've been trying or hoping to change, planning to change for years. But, an hour goes by, a week goes by, a month goes by, and you haven't changed it. Now we have the perfect opportunity. Everything is changing anyway. We now have the life we choose. We are encouraged by events to rethink where we put our energies. What are we living for? What are we getting up in the morning for? The world is going to be a much better place as soon as this thing is over. That is really a pre-Pesach message. Every generation has to come out of its Mitzrayim, out of its enslavement. And what we're seeing now is, like in the days of Egypt, Jews were pushed out of Mitzrayim. They were being pushed out of their habits. We didn't volunteer. It's being done for us. If we take advantage, if we keep our heads and we see the opportunities, by Pesach time, we can have a much healthier life, a much healthier planet. All assumptions can now be questioned. All habits can now be challenged. All fears can now be dismissed. Were we worried about China? Were we worried about Iran? Were we worried about the price of oil? Boy, we're getting slow. Everything is changing. And it is changing. It's a good thing. Not scary at all. Exciting. And we are maturing as a human race. That is a beautiful thing. It's not a warning. It's not a punishment. It's not doomsday. This is going to pass. And we're going to find ourselves in a cleaner, healthier, more noble world, politically, geographically, financially, and personally. So now is the time to think not of ourselves, but of others.
I think you guys get the picture. Hopefully your mood's been lightened and you feel a little bit better about the situation. So what is the coronavirus? I want to use this as an opportunity to teach you guys about a really great tool that the World Health Organization has come out with. It's texting on WhatsApp, so everybody's familiar. I will show you. So you text yes to a certain number that I'll give you guys later, and it comes up with, you text hi. So this is what you get. I don't know if you guys can see it, probably not. But you get latest numbers, how to protect yourself, some questions, myths, travel advice, news, and press. So I decided to see what the common questions were. And one of them is, what are coronaviruses? What is COVID-19? And how does it relate to SARS? So I'll read a little bit for you guys so you can see how much it is. Good. So what is coronavirus? Coronaviruses are a large family of virus which can cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East respiratory syndrome and SARS. The most recently discovered coronavirus causing coronavirus disease is COVID-19. COVID-19 is the infectious disease caused by blah, blah, blah. Okay, so I'll explain to you how they kind of differ. So as you can see on the right, okay, as you can see on the right, there's a model of what this virus, what put together, what it is, whatever. So on the outside, there's proteins that stick out like spikes. They're called S proteins, and they're used to grab onto cells to stick to them and insert their genetic material. They stick out of the envelope where the genetic material is, and they look like fingers, or it kind of resembles a crown, and crown in Latin is corona. So the way that we got it is kind of amazing. So coronaviruses, they all start in animals. So originally this coronavirus started in bats, and somehow bats interacted with an animal called the pangolin. So apparently it looks like a cross between an anteater and an armadillo, and they're used like in the pet trade, I guess in China, illegal pet trade, and that's how it was introduced to humans in the market. That was the place where it originated. So the virus's ability to go from a bat to an anteater to people is caused by mutations. These happen all the time. Viruses mutate all the time, which is why you can get all these different kinds of flus, why you can get the flu every year, because the viruses change. We'll talk more about how getting it again, possibility of getting it again later, but usually when a virus mutates, it mutates to become less deadly, because a virus can't survive in a host that's not living. So in order to ensure its own survival, it'll mutate to become less, not as bad, which is good, but that's most of the time. Okay, good. So you guys are probably getting all these different inputs from the news about like the way that they think it's going to act, or how bad it's going to be, or how long it stays certain places. And we make these predictions based on looking at other related viruses. So the closest thing we've ever seen is the SARS virus. And actually our body, the reason this is so bad, so much worse than the flu, so every year different flus go around, but common ones go around. So I don't know if you guys know this, but H1N1, the swine flu, is predicted to be one of the most common strains this year. But because a lot of people had swine flu a couple years ago, not as many people get sick. So it's not as bad. But the only thing that's even close is the SARS coronavirus, which very few people got, and especially outside of China. So basically the whole world has no defense for this. And so we look at the way that SARS did act and how it spread, and we use that information to make a lot of our predictions. And again, a quarter of the common cold illnesses are caused by coronavirus, and an even larger majority of the coronaviruses don't cause any symptoms at all. And a lot of the models that we make, are based on how well people are adhering to social distancing and hand washing and listening to the recommendations. And so we really are predicting that we have is speculation. So you need to remember that. On the right, here you see the S proteins bonding to the receptors on the outside of cells, and then giving its genetic material to the cell. And in that cell, it uses the machinery of the cell to make more of itself. And it gets to a point where so many have been made inside the cell that the cell kind of explodes, and more viruses are released to infect other cells. On the right, it's an example of what you see on a CAT scan with coronavirus, but also a lot of other respiratory illnesses. It's something called like a ground glass appearance. It's really not important. You might hear it in the news. So the reason SARS is so deadly, well, actually, I'll show you the video first, quick video.
Your nose, face, or mouth. So what happens when it enters your body? The virus sits in the throat and the upper respiratory tract. In most cases, around 80 to 85% of them, symptoms are mild and they'll quickly pass. You may get a sore throat or a dry cough. Your throat may be red. As your immune system kicks in and you start to fight the invading virus, you may also get a temperature. Your body temperature increases as it tries to create a hostile environment for the virus. In other, more severe cases, the virus can attack the lungs and cause pneumonia. This affects maybe 15 to 20% of people. It binds to two types of cells in the lungs and causes them to clog up: goblet cells that produce mucus and cilia cells, which have hairs on them and normally prevent your lungs from filling up with debris and fluid. Generally, most people recover from pneumonia, which can take up to 10 days to peak. In the most critical cases, though, coronavirus can be fatal, particularly for the elderly and those with other health conditions. In very rare cases, your immune system can go into overdrive. It produces a flood of white blood cells which activate chemicals and can leak into the lungs. This, combined with the virus's attack on the lungs, damages the cells even further and can make...
So you kind of see the progression. It's a slow burn, they say. It's like symptoms start very mild and then they progress over the course of 5 days. And they say at about 5 days, shortness of breath will develop. And by day 7, 8, your body kind of decides if it's going to be able to fight it or not, or if you're going to get a lot worse. So it's really important to pay attention to your symptoms. If you don't start getting better after a week, if you start getting worse, you should definitely seek medical attention. So after it causes that yellow stuff, that debris and white blood cells, that's like it's pus. We call it purulent, purulence. And it's a lot harder to get rid of. And all of that going on in the lungs causes inflammation. It causes swelling in something called alveoli, which is where the air interacts with the blood. It's like they're very thin, so it's close to the blood, and it's where oxygen and carbon dioxide are exchanged in the lungs, but they swell and they get angry, and the skin there gets a lot thicker, and it's a lot harder to get oxygen into your bloodstream. So that's why a lot of people get super, super sick, need a ventilator. That's called acute respiratory distress syndrome, when you can't oxygenate the blood well enough on your own, you need help. There's also things that we use besides just intubation, like the tube down your throat, which is the ventilators. We use BiPAP, which is kind of like CPAP. We help force the air into the lungs. So there's other machines, not as bad. Also, if your lungs can't oxygenate even with the breathing, we have something called ECMO. It's called extracorporeal membrane oxygenation, where it's basically a machine that takes the blood out, oxygenates it, and puts it back. So we can really support people when they're really, really sick. It's really amazing. So after that, if things keep getting worse, you enter septic shock, which is where a lot of people die. Organs start shutting down. But usually that's in people with very poor immune systems, their bodies are tired. Usually not young people, although cases have occurred and are occurring. So transmission, how do you get it? People are freaking out. I don't know if anyone's been to the grocery store lately, but it's really a scene. So it's through droplets generated when an infected person coughs, sneezes, or through droplets of saliva or discharge from the nose. So people are like coughing and wiping their noses and then touching things, and that's how you get it from touching things. There is limited evidence, very few studies showing how long it really lasts on surfaces, and especially it's very dependent on multiple things like temperature and humidity and surface types. Like when a virus or bacteria has something to grow in, it has like moisture and nutrients, like in snot or phlegm, it grows really well, and that'll stay on the surface for a long time. But if it's just there without that, it won't be at all. So anywhere from 2 hours to 9 days. In the air, there's been one study that showed that it could last 3 hours in the air, but that was in a very closed environment. Like there were people walking around, the wind wasn't blowing. It's not a simulation of real world. So I would think it would be significantly lower than that. And when should you worry? You should never worry. When you walk past somebody on the street, unless they're like coughing in your face, like you're not going to get it. So we classify people who've come in contact with COVID-19 patients in danger when they were within 6 feet to 1 to 2 meters of the patient for more than 15 minutes. We consider that a long time. So you're going to hear things called like imported cases, local transmission, and community transmission. So dad coughs or sneezes, and he gives it to grandma, and grandma goes home right? So home, it's been imported to home, direct one to the other person. Then she gives it to grandpa. Grandpa is the ice cream man. Grandpa gives it to tons of people. We know it was him. Like typhoid Mary was a cook, so many people got typhoid back in the day, and that's called local transmission. Community transmission is what we're seeing now in most places, and it's when someone gets the virus and has no known contact with anybody who's had contact with anybody who has it. It's kind of a mystery, but that just tells us that there's enough people in a community that have it and don't know it and are able to pass it to other people. So, but it's okay. It's not that scary because we're doing a great job with social distancing and quarantining and hygiene. So the incubation period, a lot of people ask me about this, on average is 4 to 5 days, 5.1, but it can be anywhere from between 2 and 14 days. You're contagious 1 to 2 days before symptoms, and you're more contagious right after the onset of the disease. I want to teach you guys about something not. It's a great number to know because it tells us how many people a person who, okay, if one person has coronavirus, how many people that person is likely to infect. So if the R naught number is less than 1, that means that the pandemic is decreasing. The rate of transmission is decreasing. It's good because it's one person's transmitting to less than 1%. If the R naught is 1, that means it's stable because 1 to 1. Greater than 1, that means it's still spreading. It's growing. So when you look at how contagious things are, the flu has an R naught of 1.3, which means one person with the flu generally affects 1.3 people, and COVID-19 is an R naught of 2.2. So it's more contagious because one person will pass it to more than one person. So how it compares to other viruses. It's very hard to distinguish clinically, like based on your symptoms until you stop breathing, between the coronavirus and other upper respiratory, lower respiratory diseases. The difference to look at here is really between the flu. You're not going to be sneezing, and you may have a stuffy nose, but rarely, and maybe a sore throat and maybe headaches. But with the flu, you always have headaches. It's very close. It's close. And on the right, this chart is showing you R naught on the x-axis. So like how many people are going to affect each person, how contagious it is versus how deadly it is. And you see how coronavirus compares to things like SARS and smallpox and the common cold and seasonal flu. But the range is so big because we really have such limited data. It's all happened so quickly. So I think I have corona. I'm dying. I'm a very dramatic person. All of you know me. And I always think I have it. I thought I had it 5 times already. So I'm going to give you guys some facts about the symptoms that are the most common and really what to look out for. So in fever, 99% of patients have fever. Most patients have fever. Most patients are tired. And only 59% actually have a dry cough. So this is on presentation. Loss of appetite, so in 40%, muscle pains, shortness of breath, and then like a wet cough in 27%. Less common things, it's causing some really strange things in just a few patients. Diarrhea is happening, but sore throat, headache, rhinorrhea is your nose running, but it's causing things like pink eye, viral conjunctivitis, and heart issues and liver issues. Very, very rare though, and only in people who are super sick usually. And I talked about how symptoms worsen over 5 to 8 days, and you need to watch and see if you get worse after 8 days. Testing. There's so much talk about testing and not having enough testing, and who's going to be tested, and I can't get this and I can't get that. So I'll tell you the testing. So it's called polymerase chain reaction, PCR, and it identifies the virus based on its genetic fingerprint, which is their DNA, RNA, whatever. And so this test has a high sensitivity and a low specificity, which means that it's really good at detecting the virus when somebody has it, but also there's going to be a lot of false positives. So it's good and bad. Bad for the people who don't have it and think they have it for sure. And it's done with the nose. Sometimes it's done with the mouth swab, but they're really tested together. Also, we use a chest CAT scan to see that ground glass appearance. And it's really important when somebody is being tested for coronavirus to also be tested for things like the flu and other respiratory viral possible causes. There's also going to be some abnormalities on like your blood tests, like cells, white blood cells start like thrombocytopenia. It's like things, your platelets start shredding. There's not enough platelets, but don't worry about that. It's very common, it happens in other things. So the treatments and research. There are current treatments that are being used widely, actually, in China and Italy, and even in the US, is remdesivir, and it was developed and pushed through clinical trials quickly to treat Ebola. But it's showing some symptoms. In America, it's like, it says used for like compassionate care. So it's a way of saying it's not that recommended because the research hasn't been done, but it's been working, it's been good. We also have chloroquine and hydroxychloroquine. It's usually used to treat malaria and prevent malaria. I don't know if anybody's been to a country where malaria is endemic, but it's used for prophylaxis, so you don't get it. It's also shown some promise. So in terms of a vaccine, there's things. They've developed some things. They said at least 12 to 18 months, and that new drug treatments will likely come sooner. 18 months is like the shortest any vaccine has ever been approved for people, and it's like very, very hopeful that it'll be 18 months. But things are being doing now and shown us in China, where they're taking the blood of people who have been infected and recovered, and taking the antibodies that they develop to help fight it, make sure they don't get it again, out, and giving it to people who don't have the antibodies, who are really sick. And it showed really great improvement in some patients, but the sample size is not that big to be like, oh, it's definitely. People really rely on evidence-based medicine, so they don't want to be like, oh, definitely. And so China has actually sent a large amount of plasma. Plasma is like part of your blood that has the antibodies to Italy, like a lot of it. So can I get your number? Reliable numbers and statistics. This is something that you see different numbers everywhere, and it's really confusing. And I really trust the World Health Organization and the CDC, Center for Disease Control in the United States, and basically most governmental websites, although we all know that some governments are better than other governments about reporting what's really going on. So I want to show you guys some of those websites. You know it's available to you. So this is the World Health Organization website, and there's videos and questions and travel advice, basically any question you could have. There's some actually really great videos. I really like this one. And there's always the numbers here for you. Another great thing, if you're really a numbers person, are these situation reports. You can just Google like World Health Organization situation reports, and it'll come up with every single day, and it looks like this. This was yesterday. And it tells you new countries that have it, the exact numbers in different regions. And then here it's warning about different people who have been trying to scam people to get money. And then you have a map, and then it has, we'll go to Israel. So here, Israel, you can see there was 883 cases yesterday, but 171 of them are new, and we've had 1 death and no new deaths, whereas Turkey had 21 deaths and 12 of them just happened yesterday. It's a good way to look at it. And then some other things at the bottom, there's also some other resources about new things that are happening. And this is the CDC website. It's pretty good. Different things. If you're searching for something specific, you can check out both. Okay. That's good. So people are dying. We know people are dying, and it's really scary. But there's some things to know. So if you're worried about children do not get nearly as sick. Only under 19, only 2.5% fatality. I think that's Oh no, only 2.5% of the people diagnosed are under the age of 19. And only 0.02% of those become critical. But there's been no children who've died. On pregnant women, we're really looking at how SARS affected women. It's not in breast milk, but if a mother's breastfeeding, it's close contact for a significant amount of time. There's not been a baby born with it, but babies who had it did get it shortly after birth. So in terms of recovery, it's about 2 weeks for the mild infection and 3 to 6 weeks for the severe disease. This is the case fatality rates. These numbers are so skewed because of the significant amount of people who have it and don't know they have it and are walking around like, hanging out with their friends, going to restaurants, those different things. Or even because the incubation period is between 2 and 14 days, people could have been out before these regulations were put into place and interacting with people. So these rates are even lower, I think, than they say they are. But you can see older people are significantly more likely to experience a fatality after acquiring this disease. It's also increased risk of fatality with high blood pressure, diabetes, heart disease, chronic respiratory diseases like asthma or COPD. COPD is people who have smoked for a really long time and they often need to walk around with oxygen or they need steroids to help them breathe. And then cancer, a lot of these cancer patients are on immunosuppressants. And you see how it compares to zero. So when you look at older people are more likely to have one of these things. So if they're old and they have hypertension and diabetes and cardiovascular disease. And so this is why younger people are not getting as sick. So what can you do? Preparedness starts with funding. So if you guys are dead set on helping, but you can't leave your house, you can donate to the World Health Organization or a charity of your choice that you feel like is doing great things. So you can avoid travel to places where there's significant amounts of disease, stay away from crowded places. We talked about distancing, masks we'll get to, clean and sterilized surfaces, hand washing, and avoid touching your T-zone. So your T-zone, your face, your eyes, your nose, your mouth. So I'm sure you guys have heard about flattening the curve. I'll explain it. So here you have two parabola. What are they? I don't know. Okay, so this dotted line is how many sick people a hospital can actually take care of. So if we don't do anything, like they didn't do things early enough in Italy, so many more people than that we can actually take care of get sick. There's not enough beds in the intensive care unit, not enough doctors to care for them, not enough ventilators, not enough. And so a lot of people pass away that didn't have to pass away. And these beds are also being taken from people who would normally be in the intensive care unit and need that attention. So people without coronavirus are actually dying at higher rates because of this. But if we all do our part and we listen and we wash our hands, and we stay at home, we can spread it out. So the difference between this being catastrophic and just being really horrible is how fast everybody gets the disease. So if it happens in 3 months versus it happens in 3 years, if it happens over a significant amount of time, the resources are spread out and the system's not overwhelmed. And this is why we're trying to flatten the curve and do the social distancing so that the healthcare workers can do what they have to do and there's enough ventilators for everybody and people don't have to die unnecessarily. So you're feeling it, right? You think you have coronavirus. So if you have a fever greater than 100.4, a cough, but it's not difficult to breathe, don't go to the hospital. They're already overwhelmed. You're going to be okay, especially you're young, you don't have any other issues going on. If you feel worse after 5 days into the illness, definitely call a doctor. And if you really need to go to the hospital, unless you are really having trouble breathing, don't. and then go. But it'd be better to call somebody first so the transportation can be arranged. Hospitals and clinics are already overwhelmed. Stay at home, but do not hesitate to seek care if you really feel like you need it. It's better to be sorry, especially because it can start going downhill in the second week. And if you feel better, so you have it and you're diagnosed, you can leave the house when you don't have a fever without taking Advil or Tylenol. You don't have trouble breathing, and you have 2 consecutive negative coronavirus tests, greater than 24 hours apart, or 7 days from symptom onset. At least 3 days have passed since you're recovered, no fever, and that's it. So I'm sure you guys have heard about not taking Advil, ibuprofen, naproxen, something called NSAIDs, non-steroidal anti-inflammatory drugs, like Aleve, and it's basically most things besides Tylenol, acetaminophen. I'm not sure what it's called here. And it's because there was a study of a small population in young people in China who showed worse outcomes after being given ibuprofen. That's one study, and currently the World Health Organization in Europe does not discourage the use of these drugs when they're really clinically indicated, when they're necessary. So the mask, this thing gets me nuts, these surgical masks. You see the cashiers like half off, half on, people pulling it down to talk to you. It's a whole mess. So these surgical masks, the blue ones, are just designed to help prevent germs from getting out, not from getting in. Because when you're doing a surgery over, a sterile environment, you don't want to breathe your germs onto the person that you're operating on. So they're really not that effective. N95 masks are really for healthcare workers. And they don't even have to wear the N95 mask when they're not operating on an airway, like putting the tube in to help people breathe, things like that. And they also go through something, I had to do this when I was working. You sit there for 20 plus minutes and they give you like 5 different kinds of N95 masks, and they like test the seal. So there no air can get it in like that. And that's when they're effective. They cause other issues because it causes you to touch your face. And so, but if you do decide to wear a mask, I know that you will. So please use it once. Make sure it fits your face, that you're not touching it. If you see that you touch it, wash your hands. Always wash your hands anytime you touch your face, mask, whatever. And you have to remove it from the back. Don't like grab it this way. Take it off in the back and then wash your hands again. There's also some approved and not approved facial hair for these masks. You can see on the right. We're gonna see a lot of odd facial hair, I feel like. Okay. Okay, so your hands, washing your hands. Just stop touching your face. Like, don't do it. Try your hardest. It's super hard. You're probably gonna do it more now that you're thinking about it. Don't do it. Hand washing is really good. It's probably the best, but alcohol-based sanitizers greater than 60% or above are also okay. There's been jokes about using Sparkle Bath & Body Works sanitizer. Still works. It's like 68%. I checked. You can still use just sparkly, great smelling ones. Hand washing for at least 20 seconds. This has to do with the envelope that we talked about, that encases the genetic material. The substance in soap helps break down the fats in the layer to help kind of burst it, and that is done over time. So it needs that time to break down those envelopes, and that's why you do it for 20 seconds. So some myths and facts. So make sure you cook your meat well. The World Health Organization is saying make sure your meat is well cooked. I think that they're saying this based on people eating animals in other places that are not as developed, but you should probably be doing this anyway, so check on it. There's been one confirmed case of a dog having COVID-19, but the dog showed no symptoms. You're gonna hear a lot about that. That was from the World Health Organization, so I trust it, but you never know. So I can get sick if I order a package from China. Not true. After being shipped and changing in temperatures, and we learned that it can't survive on surfaces that long, especially under unfavorable conditions. So you don't have to go to the hospital if you have mild symptoms. Coronavirus cannot survive in hot weather. It's not true. It would need to be a certain level of heat. We see the flu happening in the summer sometimes, and it's happening in the southern hemisphere less so, but it's happening, and we don't have any evidence to say that this is true. We just don't know yet. So a hot bath or a blow dryer at my nose will help prevent me from getting sick. I actually have a friend who was blow drying up her nose. This is not a joke, for real. It will not help. It will not help and can be actually harmful if it's too hot. Let's see. I can get it from a mosquito bite. It's not true. No bug can give it to you. Getting your temperature taken outside the grocery store is enough to prevent spread. In Beit Shean, some guy took my temperature like this from like 6 feet away. And I get it, but a lot of the times people don't have fevers early on. So when they're so contagious, like 1 or 2 days before, you can still be contagious. So the neti pot will help prevent infection. You can't, no saline rinse, like rinsing your nostrils won't help either. Garlic, people have been using garlic for other things. I don't know that they shouldn't be using it for. It also does not help. And antibiotics help. They don't help. They only help when after the virus enters your lungs, you can get a bacterial infection on top of that viral infection, and then we use the antibiotics to help kill that virus, like kill those bacteria as well. So these are some great resources for you guys. I'll give you guys a minute to look at this. We're getting towards the end. And so you can text hi to this number on WhatsApp. It's a really great resource to get access to information that's accurate really quickly. You can answer a lot of questions. You can get the numbers for people who are busy or don't want to stay and watch the news all day. Really, really great. I love the situation reports for accurate number. A lot of really, really good information on the Johns Hopkins Public Health website. I linked that, so it's coronavirus.hu.edu and globalhealthnow.org. I'm hearing somebody. Okay, so in Israel, I particularly did not find the Israeli health website very helpful in making this presentation. This is the statistics I found based on cases and deaths. Worldwide, it's actually been shown that men develop worse disease than women do, but men also have like a higher rate of those comorbidities, those other bad things. So you can look at it that way. So these numbers are really important. I want you guys to write them down. So if you think you have it, or you don't know what to do, or you have a question about the area or the laws that are being put into place now, call the Ministry of Health, star 5400. And I know the people in the periphery have Khalid, and that's the number for Khalid. If you're like, oh, can I go to the hospital? Should I go to the hospital? How do I get there? Star 2700. And on the right, you can see a distribution of where people who have coronavirus live, mostly in the center. And they also have reports on the website about each patient, where they were, where they live, so you can kind of sauce it out. I'm sure some of you guys have heard about the like spy technology being used to track people who are in quarantine, or let people know who've been in contact with COVID-19 patients. So they're actually not allowed to track people in quarantine anymore. They just decided it was not legal. I don't know the finesse of it, but but they still will text you and see, like, say you were at a restaurant and you found that the waitress that was serving you no, okay, we're back. They can use the tracking information to see who was near her for a significant amount of time and send those people text messages whether or not they were exposed and if they should be in quarantine. So other countries, I don't know if you guys have seen this news story about Russia unleashing 500 lions into the street. Not true. This is not true. And grocery stores in America where people are getting in fights over toilet paper. My sister was in Trader Joe's in New York City and saw two guys get in a fist fight because one breathed on the other one. People are going insane. Also, what did I want to say? The Israeli government. There was something else. I'll remember. So, current state of things. To give you some hope, in South Korea and China, the number of new cases per day has been started dropping. So the R naught is less than 1, which is fantastic. So likely 60-65% of the northern hemisphere populations will have the virus by July or August. These are predictions. They're thinking it'll start to diminish in late summer, and then attention will shift to the south, and it'll start becoming a significant issue in the southern hemisphere. And then they think it'll come back and slowly return, so that these things are moving in waves that can persist for years. But every time it comes back, it won't be as bad because people in the community will have built antibodies to the virus and will be able to fight it a lot easier. And we'll have developed vaccines and treatments, and we'll be more prepared for it next time it happens. So it's not such a scary thing, but I want to be frank with you guys and know that this is not something that's just going to go away very soon. So how long will social distancing last? They're thinking, experts are saying between 2 and 3 months here in the northern hemisphere. So will this ever end? So like I said, it's going to be coming in waves, and the vaccine will be available in minimum 18 months. And this 18-month cutoff mark about when this thing will be over, some people will be like, oh, it's going to be over in 18 months. It's because that's when the vaccine is projected to be ready. But it'll really be over when everyone has developed immunity. So when everybody gets it, or herd immunity, like they say, you get the flu vaccine and not everyone has to get it because most people get it, then nobody will be able to pass to each other. Herd immunity. Financial crisis, so sorry, cannot help you. I know nothing, but it's good to be aware of. And then these are some of the resources that I used. Okay, good. So now I want to open it up to questions you guys have. So I don't know if Rochelle can unmute people, unmute everybody.
Yeah, I'm gonna do that right now.
So when everybody's unmuted, you can like mute yourself if you don't want to be heard, or ask a question if you had one.
Isaac doesn't want to talk. It's cool. It's cool. A lot of people self-muted themselves.
Right, so no questions. You guys can also text me or call me or email me or whatever.
I have a question. I have a question.
Okay.
Do you know at all where the term social distancing came from? Like how someone decided on that specific term? I've just been thinking about, I don't know, political repercussions, social repercussions, if anybody's talked about it whatsoever.
So I don't know specifically, but I can use the most probable answer.
Okay.
A lot of the information being given out today by the governments and the news is very of what's going on in the world, like elections and being politically correct. Sorry, there's like a huge bug. It's probably hilarious. Okay. Sorry. They're aware, so I'm sure that whoever chose it with that in mind. They're being really careful. But most likely it was the World Health Organization. They're really setting the precedents for the names and the guidelines, and I can research it for you. I'll let you know.
Thank you.
Okay. Anyone else? No? thanks guys for coming. Thanks today. I hope you guys got something out of it. Please feel free to email me. My email is Zamkoff, my last name, @gmail.com. Or thanks guys.